In this video, I'll go over spine-friendly exercises that apply to nearly every spine condition in a post-rehab or general fitness or medical fitness atmosphere. And I'll also jump straight to the conclusion so that you understand the theme as you're watching the video. There are some spine conditions such as a herniated disc or arthritis where you need to be wary of going into too much flexion or rotation. And there are other spine conditions such as stenosis or one of the spondys where you need to be wary of going into too much extension, because in those conditions I just mentioned, excessive flexion, rotation, or extension is what will exacerbate pain or discomfort. And so whenever you're training with a spine condition or training someone with a spine condition, if you're a personal trainer, the key to setting a safe foundation is taking movement out of the equation so that you're contracting and strengthening the core musculature isometrically. And then when you establish some core strength through safe isometric strengthening, you can begin to add movement into the equation. And I would highly suggest in that case that you ensure the movement is minimal and the loads are light, and you maintain a shortened range of motion and light loads for 2 to 3 week phases or blocks before progressing. And then when you progress, you can just add a little bit more movement into the equation. Depending on the situation, you might also want to increase the load, and then you stay there for 2 to 3 week phases or blocks to ensure that the body is responding well to the progression. And then at some point, you just have to make the executive decision as to how much movement is enough, which is going to be a case-by-case situation. And there might be some situations where you are going to feel a little bit of discomfort, and in that case, you're going to know exactly where your threshold is, and then you just make sure that you stay within your pain-free range of motion with every successive repetition. So with all that said, we'll start with examples of spine-friendly exercises where movement is taken out of the equation that are obviously going to be safe in pretty much every situation. The first is a low back extension hold. In this video, you see that their arms are out as though the person is making a T or an airplane wings. The purpose of that is to contract the upper back musculature along with the spinal erectors. And I just tell people to raise up just a little bit at first, just enough so that they can feel the muscles contract. We may only begin with 10 or 15 seconds and then increase to 30, 45, or maybe 60 seconds at the most. And over the course of time, you can determine how much you want the person to raise their torso off the ground or off the mat or the table. But this is a nice, safe, spine-friendly exercise that moderately strengthens the spinal erectors. And the next is what I call a prone bird dog, where if the person has some sort of shoulder issue or shoulder pain, you can do a modified version of it, such as this. Or if their shoulders are healthy, then you can have them extend their arms with their palms facing each other. And in either case, you're going to have them slowly raise opposite arm and leg. To keep it safe, you just raise the leg a little bit so that there's very little extension going on in the lumbar spine. And I prefer this over a quadruped bird dog where the person is on all fours, because if you compare the two, you can feel the core musculature brace harder in this version than in a quadruped bird dog. And you can really feel it in the deep muscles of your lumbar spine, which are called your multifidi. So with few exceptions, I'll begin a client with either a regular prone bird dog where their arms are extended or a modified version to make it a little bit easier on their shoulders or on their low back. Next up are plank versions, such as a modified plank where the person is on their knees, or a regular plank where they have 4 points of contact, their forearms and their feet. And if necessary, I'll begin them with a modified plank, and once they can perform about 30 seconds to a minute, I'll progress them to a regular plank. And then I do the same thing with a side plank, where I may begin with a modified side plank where the points of contact are their knees and their forearm. And once they can comfortably hold that in the 30 to 60 second range, I'll have them raise up so that they either have 2 points or 3 points of contact with their forearm, 1 foot, or both feet. Another safe, spine-friendly exercise I like to program for most of my clients is what I call a cable anti-rotation, which is slightly different from a pale-off press, where in a pale-off press, you hold the cable into your sternum and then you press it out and hold for a couple seconds and then bring it back into your sternum. But what I do is have my clients get into position, press out, and then just hold for anywhere from 20 to 45 seconds, which keeps constant tension and forces you to brace your core the entire time. And then other spine-friendly exercises would be Pilates mat exercises, such as a very simple and basic march for someone who's weak in their core and needs to start at that lower level. A possible progression from there would be a slow bicycle, where the person extends their legs out in a slow, controlled fashion with some mind-body connection on their low back and pelvis to try to minimize or negate any movement. And then from there, they could add their arms into the equation and turn the slow bicycle into a dying bug. But for me personally, when the person is ready for it, I like to progress them into what I call a modified Pilates hundreds, where I would have them raise their torso slightly off the mat to begin to contract their core muscles, hover their arms over the mat or the table or whatever apparatus they're lying on, and then begin to extend their legs to a point where it becomes challenging for them. And in some cases, there won't be much extension, but my goal is to find their start point and then build them up to where they can hold that for somewhere around 45 seconds, give or take. And then I'll begin to have them extend their legs further out, because the further they extend their legs, the more challenging it is for their core. With one of the main points being that we want to maintain a neutral lumbar spine and make sure they don't create any arch in their lumbar spine. So those are examples of spine-friendly exercises where we take movement out of the equation. And when it's time to add movement into the equation, which really doesn't have to take too long because you're going to start by being very conservative. And so what you do is just make sure that you only add a little bit of range of motion, whether it's in flexion, such as a crunch, or in this case, a modified crunch where I have the individual pull their knees in towards their chest so that their hips are at about a 90-degree angle. That way I'm taking out any movement in their lumbar spine so that it's all coming from the thoracic spine and is very safe on the low back. Or as you'll see in the other exercises in this video, it's really just a matter of shortening the range of motion in all types of spine movements, such as rotation, lateral bending, or extension, and making sure that the loads are light, that the RPE or rate of perceived exertion is light to moderate, and you use all that to find their start point and to make sure that you're staying within their pain-free range of motion before you begin to progress them. So the next example would be a cable rotation, but this would really apply to any type of rotation. You just shorten the range of motion and perform what I call a pulse, which would actually be a shorter range of motion than what you're seeing in this video, where the person really just rotates from about 11 o'clock to 1 o'clock. And this, combined with light loads, is your way to be conservative and find their pain-free range of motion. As previously mentioned, you stay there in 2 to 3 week phases to make sure their body is responding appropriately. And then you can progress by either slightly increasing the load or slightly increasing the range of motion, and then stay there for 2 to 3 week phases before you progress. And then lastly, I wanted to put in a deadlift as a spine-friendly exercise, which is counterintuitive to a lot of people. But the reason it is a spine-friendly exercise is because you can always reduce the frequency that you're going to perform them, the intensity, or in other words, how close you take them to muscle failure, and also lighten the loads. And then another thing you can do, which you're seeing in this video, is shorten the range of motion. Now, this wouldn't be an ideal situation where you're placing the plates on top of a Reebok riser, but it's all we had available. And I just wanted to use it as a way to show that it's another way that you can make a deadlift safe, because you can always adjust range of motion and start as conservatively as you want. Establish a baseline level of strength within that conservative range of motion, and then begin to either increase the load and or increase the range of motion, where in this case we would take the risers away so that the individual is pulling directly from the ground. So in conclusion, the overall concept is pretty simple. No matter what the spine condition is in a post-rehab, general fitness, or medical fitness atmosphere, the approach should always be to begin core strengthening by taking movement out of the equation so that you can establish some baseline level of strength or strength endurance in the core. And then when you add movement into the equation, just do it in small, tolerable increments in 2 to 3 week phases. Make sure that their body is responding well. And then you can make your own executive decision as to whether you want to progress by increasing range of motion, increasing the load, or a little bit of both.